You know, deep inside your bones, there's this incredible microscopic factory that's running 24/7. It's building the very stuff of life, your blood. It's an absolute marvel. But what happens when that production line goes completely haywire? What if the factory starts pumping out a product that, instead of protecting you, actually tries to take over?
So what you're looking at here, this is the official blueprint for that blood factory. It's a process called hematopoiesis. Just look at how that one master cell at the top, the stem cell, branches out and creates everything. You've got red blood cells for oxygen, platelets for clotting, and all these different white blood cells to fight infections. This, right here, is how it's supposed to work. To really get our heads around what goes wrong in leukemia, we first gotta appreciate the amazing process that's humming along perfectly every single day inside our bone marrow. Let's just think about it like this. Your bone marrow is the manufacturing plant. It's got three main product lines. You've got your red blood cells. They're kind of like the delivery trucks carrying oxygen everywhere. Then you've got your white blood cells. They're the security guards, the soldiers defending your body. And finally, you have platelets, the emergency repair crew that rushes in to patch up any leaks. Three totally critical jobs, all coming from one single factory. Okay, so now let's talk about what happens when there's a major malfunction in that factory, specifically a breakdown on the assembly line for one particular type of white blood cell. This is what we call acute lymphoblastic leukemia, or ALL for short. It's a cancer that starts right there at the source. The factory gets a bad set of instructions and just starts mass-producing these defective white blood cells. It's churning out these totally immature versions of what are supposed to be B cells or T cells. And these faulty products? They've got a name: lymphoblasts. They're like soldiers who dropped out of basic training. They might look a bit like white blood cells, but they are completely useless. They can't do their job, they can't fight infection, and worse, they come with a really terrible design flaw. And right here, you can actually see the enemy. These purple cells, those are the lymphoblasts. See how they're all kind of packed together, all looking the same? This is exactly what a pathologist sees down the microscope when they're diagnosing ALL. And here's that terrible design flaw I mentioned. These lymphoblasts, they just don't have an off switch. They just keep dividing and multiplying, taking up more and more space in the bone marrow. They're like squatters who completely take over, and they start shoving all the other production lines for the healthy, essential cells out of the way. So this internal crisis, this massive traffic jam happening inside your bones, well, it doesn't stay a secret for very long. It starts sending out some pretty clear warning signs, things you can actually see and feel on the outside. This image here shows exactly how that internal problem starts showing up externally. Every single one of these symptoms, the fatigue, getting sick all the time, bruising easily, even bone pain, they're all direct results of that bone marrow factory getting totally overrun by those useless lymphoblasts. Let's just connect the dots here, because it's a really clear cause and effect. The lymphoblasts crowd out red blood cell production. Boom, you get anemia, and you feel exhausted and out of breath. They crowd out the healthy white blood cells. Well, now your body can't fight off infections. They crowd out platelets. Now you're bruising and bleeding for no good reason. See? It's a direct chain reaction. But once the problem is identified, that's when the counterattack begins. The whole goal is to shut down that faulty production line and reclaim the factory for the good guys, the healthy cells. Now, the first major goal is something called remission. And it's really important to know, remission isn't the same thing as a cure, but it is a huge first victory. It means that the first wave of treatment worked, it wiped out most of the cancer cells, and it's given the bone marrow a chance to start working normally again. But even in remission, some of those enemy cells can still be hiding out. So the battle plan usually has three main phases. First up is induction. This is the big upfront assault to get to remission. Next is consolidation. You can think of this like sending in special forces to hunt down any survivors that are still hiding. And finally, there's maintenance. This is a much longer, lower dose treatment, sort of like posting guards around the factory to make sure the enemy doesn't try to stage a comeback. All right, so how does this battle usually turn out? The outlook, or what doctors call the prognosis, really depends on a few key things, like the specific nature of the enemy, the patient's own defenses, and of course, how well that initial attack works. This table gives you a quick snapshot of some of the most important factors. For example, the outcome is usually better for kids between 2 and 9. Having a lower white blood cell count when you're diagnosed is also a good sign. But maybe the most critical factor we look at today is that last one, something called MRD, or minimal residual disease.
This quote really just hits the nail on the head. After that huge initial battle, are there any enemy soldiers left hiding? Because even a tiny number can grow back and cause a full-blown relapse. Finding these hidden cells is one of the single biggest challenges in treating leukemia.
And this is where modern medicine is just making incredible leaps. MRD testing uses these super sensitive technologies. Think of them like molecular scanners that can hunt for a single cancer cell among a million healthy ones. Finding those cells tells doctors which patients need a stronger counterattack to make sure the cancer never comes back. It is truly personalizing the fight.
Which, leaves us with this really powerful and hopeful question. For decades, the fight was against the cancer you could see. Now, the battle is being fought on a microscopic level against that last handful of cells. So as our tech gets better and better at finding that one last cancer cell, you have to wonder, how close are we to making a full recovery the reality for every single person?